And good to see you, Mr. Kaufman. And thank you both for your willingness to serve. In April of this year, Secretary Hegseth posted a video where he said, and I quote, "The notion that a flu vaccine must be mandatory for every service member everywhere in every circumstance at all times is just overly broad and not rational." So, Dr. Schwartz, I want to ask you whether you agree with Secretary Hegseth. Is a flu vaccine mandate irrational and absurd?
Senator, thank you for meeting with me. As you know, I spent over 25 years in the uniformed services, and I have had my share of making the mandates for influenza and other vaccines, or at least following. I didn't make the mandate, but I followed leadership as they made the mandate for those vaccines, and I understood why. When you're in congregate living situations, when you're in submarines, when you're on ships, close quarters, it is really important to make sure that you have what we call force health protection. So I'm fully supportive of, in certain circumstances, mandating vaccines for military members, with the exception of I believe in religious exemptions, and I believe that if there's a newer vaccine, there should be some conversation as to whether that newer vaccine should be mandatory.
Okay, so you do not believe that it's irrational and absurd to have a mandatory flu vaccine mandate in the military?
There are a lot of double negatives there, but I think that what you're asking me is, do I believe in vaccine mandates for military members? I do believe in certain circumstances, yes, there should be a requirement to have mandates in the military.
Okay. Now, he also said our men and women in uniform are forced to choose between their conscience and their country, even when those decisions pose no threat to our military readiness. And Dr. Sports, I know you've spent years overseeing healthcare delivery for Coast Guard personnel and led public health and medical readiness programs, and you've spoken about vaccines and how they were critical, as you did a moment ago, to responding to an outbreak. Well, you spoke about Cape May, the Coast Guard Training Center, and wonder whether you believe that an outbreak among our armed services pose a threat to our military readiness.
Senator, as you mentioned, the example that I gave was when I was in the Coast Guard, with the Coast Guard, Cape May, Coast Guard Training Center, Cape May, we were seeing increases in febrile respiratory illnesses, and it was due to adenovirus. And we were trying our best to have non-medical countermeasures, hand washing, social distancing, but nearly impossible when you have congregate living situations and you have recruits that are taping up the faucets because they want to maintain A+ for their inspections. In 2011, when the adenovirus vaccine did become available, we did make it mandatory to make sure that we could actually prevent these outbreaks and improve readiness and improve training. And I will tell you, within a couple of weeks of us instituting that mandatory vaccine, the adenovirus vaccine, we did not see any such cases of outbreaks post the implementation of the vaccine.
So those vaccine mandates can be effective and are important. Now, also, Dr. Swartz, after your nomination, Secretary Kennedy's anti-vaccine ally, Aaron Siri, called you the queen of mandating vaccines during your time at the Coast Guard. And so what is your response to Aaron Siri and other anti-vaccine advocates criticizing you for supporting vaccine mandates?
Senator, I want to be the CDC director for all Americans. I don't want to be the CDC director just for Americans that believe in vaccines. I want to be the CDC director for Aaron Series and people that have concerns about vaccines. I approach this position with humility. I want to be a nation-centered CDC director. I want to make sure I understand why parents have vaccine hesitancy. As Sean mentioned, I don't want to ignore them. I don't want to dismiss them. I want to have an open conversation with them. I would love to have a conversation with Aaron Siri. I would love to understand his concerns about vaccines. I would love to have an open and transparent debate. And that's the kind of CDC director that I would like to be.
So it sounds like you're more polite and more reasonable than Aaron Siri, but I have one more question about vitamin K. It's an essential nutrient, as you know, which helps blood clot. And a single vitamin K shot is a highly effective intervention to prevent dangerous internal bleeding in newborns. Yet the vaccine misinformation and confusion that the Secretary's championed for years has now created a spillover effect that is increasingly causing parents to refuse the vitamin K shot and other routine care. In April of this year, Congresswoman Schreier, a pediatrician, asked the Secretary to directly confirm for worried parents that the vitamin K shot was safe, and he refused. Can you confirm for us today that the vitamin K shot is safe, and would you recommend that parents get the shots for their babies?
Senator, I can confirm that the vitamin K shot is safe. I do worry, like you, about conflation of vitamin K with other vaccines that parents may be concerned about. But vitamin K can absolutely reduce the hemorrhaging in children, newborns. I absolutely believe it is safe and it's effective, and I urge all parents to get the vitamin K shot.
Thank you.
Senator Hawley.
Thank you very much, Mr. Chairman. Thanks to the nominees for being here. Congratulations.
Senator Angela Alsobrooks used her questioning not simply to challenge the CDC director nominee, but to clarify where the nominee stood on an issue that has become increasingly politicized. Whether vaccine requirements for military personnel are justified by science and national security, or whether they represent unnecessary government overreach. Throughout the exchange, her strategy was methodical. Rather than making broad accusations, she repeatedly quoted public statements and asked the nominee whether he agreed with them, allowing viewers to compare political rhetoric with expert testimony.